Thank you, everyone who has signed up and who has already attended our webinar. My name is Danny Carlson. I'm the Communications Director for the Center for Community Solutions. We're going to give just a couple more minutes for people to join in, maybe 2 or 3, and then we will get started. Just for those of you who are on and who are listening, we will take questions throughout the presentation. You can type them into the attendee chat box that you should see on the left side of your screen. And then presenters will take as many questions as possible at the end of the presentation. And thank you again so much for joining us today.
Good afternoon, everyone. Thanks so much for joining us today. My name is Tara Britton. I'm the Director of Public Policy and Advocacy with the Center for Community Solutions. And together with Advocates for Ohio's Future, we have been co-hosting these Friday webinars throughout this working from home time that we are all in the midst of. And we're really trying to bring as much information to all of you across the state and the health and human services field about how different programs and policy areas have been impacted by the pandemic. Today, we're going to dive into how food access has been impacted throughout the course of the pandemic. We are joined by many of our state partners, and we're really pleased that they were all able to fit a little bit of time in to their schedule to talk with us today. I think they have a lot of great information to share. I am going to turn it over to Kelsey Bergfeld with Advocates for Ohio's Future here in one moment to introduce Advocates for Ohio's Future as well as our speakers. But I just wanted to say a little bit about Community Solutions. For those of you who aren't familiar, we're a nonprofit, nonpartisan organization with our main office up in Cleveland, also an office in Columbus. We're focused on a lot of health and human service issues, and we look at them we research, advocate, provide analysis and good information to make good policy decisions. So thank you again all for joining us today. I know that we will conclude with questions at the end. We also are recording this webinar, and that will be posted later on today. We will be able to share with you all of the information that is in the slides. So with that, I will turn it over to Kelsey. Thank you all.
Thanks so much, Tara. Again, this is Kelsey Bergfeld. I am the Coalition Manager with Advocates for Ohio's Future. We are a nonprofit, nonpartisan coalition of over 500 state and local health and human services, policy, advocacy, and provider organizations, and we strive to strengthen families and communities through public funding for health and human services and early care and education. We really work together to empower and support nonprofit organizations and the critical work that they do especially as it relates to lifting up the most vulnerable among us. And like Tara said, we are very excited to have some of our very close partners with us on the phone today. We will be joined by Lisa Handler-Fugit. She's the Executive Director of the Ohio State Association of Food Banks. Kimberly Lovano, she's the Director of Advocacy and Public Education at the Greater Cleveland Food Bank. Scott Neely, he's the Director of Government Affairs at the Children's Hunger Alliance. And Rachel Cahill, currently a consultant with the Center for Community Solutions. So Lisa, we are going to get right to it, and we're going to hand it off to you when you're ready.
Great. Thank you so much, Kelsey, and thank you not only to Tara and Danny, but also all of my fellow presenters. And as we convene this afternoon, I certainly hope that you are all well and safe as we weather uncharted waters in the pandemic. I want to start by just saying that even before COVID-19, the food banks had continued to experience some pretty significant demand in our services. And in relatively even in strong economic times, last year we were feeding 1.6 million different Ohioans who had turned to a food pantry for their basic food needs and their groceries. In addition, what we were seeing is a shift in the population, certainly with an increasing number of seniors who were no longer part of the workforce but really struggling to live on very limited wages, and many had taken in children, grandchildren or great-grandchildren who families had been impacted by the opioid epidemic. So again, we need to put this in the context that food banks were already poor people's grocery stores for 1.6 million of our friends and neighbors. So as things began to roll out, I don't know if we want to call this the perfect storm or a tsunami, but certainly by mid-March, just a short month ago, we were starting to see people showing up that were reporting that they had been laid off, and immediately we saw our lines at food distributions beginning to double, and in some cases tripling and quadrupling. And for many, it's really hard to fathom that so many more Ohioans were living this close to the edge, but quite frankly, we should not have been surprised. Late last year, the Federal Reserve had estimated that 4 in 10 Americans could not come up with enough cash to access and meet a $400 emergency. So as the very long days have passed, and we now are in mid-April, we are now experiencing upwards of nearly 900,000 Ohioans who now find themselves, through no fault of their own, actively seeking unemployment and the challenges. They're faced with not only a lack of income, but to have to make those trade-offs of how do I pay my rent and my mortgage, how do I pay other bills. But we all know that the most fungible portion of anybody's budget is what they have to spend on food. In addition, what we have seen is that the food supply chain is under tremendous and enormous pressure as food banks who have relied very heavily on donations. In fact, last year, 43% of all of the food that we distributed came from local food and fund drives such as Operation Feed or Harvest for Hunger. It came from manufacturers as well as retail outlets. That food, the spigot, as I say, just absolutely dried up. So not only were we facing the immediate economic impact, but also a massive demand and surge for new foods. At the same time, we began, and while we are appreciative that the federal response included additional money for TFAP, the Emergency Food Assistance Program, unfortunately, none of that food is going to be hitting any of our docks before July of this year. And in addition, we are not seeing the kind of response necessary, including a rapid employment or rapid deployment of unemployment compensation, or more people enrolling in the SNAP program for various reasons. So not only have we lost the traditional fundraising, again, food banks and food pantries rely on local food and fund drives, and those campaigns have stopped as we all move to sheltering in place due to protection and safety. So not only are we challenged from a community-based standpoint, many of the agencies that were delivering food at the local level, such as faith-based food pantries, have been forced to close down because their senior volunteers, it's not safe for them to be manning these operations, nor did they have the food supplies. So now we're seeing a decline in the overall number of agencies that are available in communities. And due to the social distancing, we have really had to shift our models from our choice food pantry models and closure of the congregate feeding or the hot meal programs. We've had to rapidly go to moving to more pre-packed and ready-to-go meals as well as shelf-stable foods. And this is a huge departure from where we have been at, and a good 50-50 mix of fresh fruits, vegetables, and lean protein items. It is getting increasingly more difficult to acquire more shelf-stable food that is now being diverted into meeting the retail demand. So there's more competition for limited food supplies out there. As I said, we're also lacking volunteer support and are dealing with our own reduced staff that can no longer come into the operations. We have been very fortunate that Governor DeWine did hear our pleas and dispatched National Guard that are working at our food banks and food pantries and distribution centers, along with the reserves. We have a complement of nearly 500 guardsmen and women that are our boots on the ground and are working to help us keep food moving through the supply chain. And as I said, we are really continued to be threatened with our food supply chains, and the food that we are purchasing, unfortunately, is getting a lot more expensive than where we were at before. So we have had to really, as I said, go to some modifications of how we are delivering food. I do recall when I first came into hunger relief efforts that what we would call mass distributions, where we would pull trucks up into given areas such as municipal lots, convention centers, county fairgrounds, and we're holding very large distributions in order to facilitate the changes in the need for us to serve more people than we've ever served before. So again, we're going to pre-packaged foods and trying to ensure that we have at least some fruits and vegetables. We have new partnerships as dairy is in surplus of trying to get more wholesome milk into the system as well. Again, in order to make sure that the staff of our food banks as well as our guardsmen and women are protected and that our clients are as well. We've gone to these no-touch delivery and distribution systems. And again, as we continue to experience the closure of more and more of our partner agencies. We are very fortunate that Governor DeWine did hear our pleas and signed an executive order on Monday to provide us with an additional $5 million that can also be spent on personal care, personal hygiene, and household cleaning items. We are very grateful. Our request is for $25 million, and we will continue to seek out support of $25 million at the current demand on our system. And I do mean the demand on our system for more food and more grocery items more frequently. We have identified that in order just to meet the demand now, it's an additional $54 million a month. So the more and the faster we can get unemployment benefits to Ohioans who have lost their job through no fault of their own, the more Ohioans that we can get onto the SNAP program and back into grocery store checkout lines, then the faster this system is going to be able to recover. And right now we are really attempting to recover from this surge that we are currently facing right now. So again, we are hopeful that the National Guard will continue to be deployed to help us as we attempt to meet a growing demand, that we will continue to receive consideration of additional funding, not only from the state level, but that we'll receive additional national reinforcements and national supplies. I know that Rachel is going to talk about some things that could happen within the SNAP program that would really help a lot, ensuring that hungry Ohioans are able to get back into those grocery store checkout lines. Also, we're serving on the governor's philanthropy strike force, which are really working at how in the short term can philanthropy be more involved in helping the basic needs. If you all remember that really hunger is the leading indicator, homelessness will be the lagging indicator. And as we continue to work through, we need to make sure that our families, especially our children who are the most vulnerable, have the ability to feed themselves and their families as we get through this. Some of the actions that Congress can take, after many weeks of struggling, we were successful in getting a declaration for the disaster household feeding program that eliminated the ability to do eligibility determination, again, promoting the social distancing, and we will continue to work on getting that one expanded. Again, there was some money in the Families First Act for additional TFAP product. The CARES Act provided some additional funding, but we need to be very vigilant and continue to advocate for each successive relief package, that we see more provisions included in helping struggling Americans meet their basic needs, and including but not limited to expansion of SNAP, expansion of child nutrition programs, expansion of TANF and the Child Care Development Block Grant, as well as the Social Services Block Grant. Again, SNAP flexibility, child nutrition flexibility, TFAP, disaster household distribution. And I will leave it there and want to thank everybody for their time and their effort. Only by working together are we going to be able to meet both the short-term and the long-term needs as Ohioans regain access to their jobs and get back on their feet. Thank you so much.
All right. Hi there, this is Kimberly Lovano from the Greater Cleveland Food Bank. Can folks hear me? Great, okay.
You're good, Kim.
Before I talk for a half hour and no one can hear me. So first, just wanted to thank everyone for the invitation to join. This is a great panel to be a part of. A special thanks to Lisa and Jory and the team at the Ohio Association. We are one of the 12 Ohio food banks that are a part of the association, and Lisa and Jory and their team just provide so much guidance and leadership to us year round, and especially during this crisis. So just a special thanks to them. And I see quite a few fellow food bankers on this call. So just a shout out to all of my coworkers who are working just incredibly hard to make sure that all of our neighbors are getting the food that they need during this crisis. So just a shout out to all of you. It's an honor to get to present on everything that we're doing. So I thought I would start out really by framing what's going on in the greater Cleveland area. Lisa gave a great overview of what is happening across Ohio. And my goal is to really talk about what that means at the local food bank level. So Lisa mentioned, the significant disruptions in the supply chain. And we have seen that decreased supply, while at the same time seeing just an unprecedented increased demand. And that increased demand can really be summed up in a few bullet points. So the Greater Cleveland Food Bank, we serve 6 counties in Northeast Ohio. So Cuyahoga County, Lake, Geauga, Ashtabula, Ashland, and Richland counties. And when you look at unemployment filings since the beginning of March, just in those 6 counties, there have been 131,000 individuals who have filed for unemployment. At the same time and in the same period, we have seen more than 8,000 families who have never been to an emergency food program before coming to our doors. And really when things have started peaking was in the last 2 weeks. 4,000 of those families were served in the last 2 weeks through not only our food bank directly, but also through our network of 1,000 partner programs. Another thing that we've seen just really skyrocket since the crisis began was the number of calls to our help center. So our help center, it sounds like it is. So it is a place where people can call. We have an on-site call center where folks can call us to find out about resources in their area. So we can connect them to a food pantry, maybe that's in their neighborhood, or any type of food program. But we can also help people apply for SNAP benefits over the phone. And typically we get about 100 calls a day, which is a lot of phone calls. We have a full team of people answering those calls. And since mid-March, we're averaging more than 2,200 calls per week in our help center. The peak day that I've heard was 1,300 calls just in one day, which is just really unprecedented and shows what the level of demand is in the Greater Cleveland area. And it also just shows, there's a lot of folks who are looking for help because they've never turned to a food program for assistance before. And at the same time that this is happening, more than 200 of our partners have had to close their doors. Like Lisa mentioned, some of those partners have had to close because they're run by folks who are vulnerable to COVID and are highest at risk. And then it's also locations that have had to close where it's a site that just can't operate with the way that their program is designed. So a lot of our partners that operated typically our after school meals programs have had to close, and we're operating, the number changes frequently, but at about 10% capacity. So we've had to find some different ways to serve kids and just everyone in our community. So when it comes to where these new families are being served, this is just a map of Cuyahoga. And what you see on this map, the blue dots are agencies that partner with us. And the larger the blue dot, the larger the number of new families who are looking for help and are visiting an emergency food program, meaning a food pantry or some sort of food distribution program. So the largest dot on that map is the food bank, which is over on the east side. Since the beginning of March, we have seen through direct distributions, which I'll talk about in a few minutes, we've seen almost 3,000 new families coming to our doors. And then you'll see on the near west side, there are a lot of those larger blue dots as well. So we're seeing spikes in folks who are looking for first-time assistance, really all across Cuyahoga County. And then if you were to see our other counties as well, that pattern is certainly there too. So some of our food supply challenges, Lisa hit on this well. Food retail donations are down about 40% over the last month. At our food bank, more than 40% typically of our food is sourced through donations. Usually we try to save purchasing product for whatever is needed that doesn't come in our doors through donations or through government product. And right now, the highest demand that we're seeing is for shelf-stable food. So similar to when you go to the grocery store, shelf-stable foods are just in high demand. But in order for us to purchase shelf-stable food, it costs us about 40 cents more per pound than fresh produce. Since we provide such large amounts of food, we typically distribute during normal times, so pre-COVID, it's about 100 to 125,000 pounds of food goes out of our warehouse on a daily basis. So you can imagine how quickly 40 cents more per pound adds up. If you looked at the difference in cost for 500,000 pounds, if we decided to buy shelf-stable food versus fresh produce, that totals $200,000. So these food supply challenges add up really quickly. And our vendors have also been impacted by supply chain issues. One good example is we had an order recently delayed, a few truckloads worth of product, and it was because they ran out of food labels. So it was just a supply chain issue that didn't have to do with food, it had to do with the labels. But as folks know, you can't distribute food without labels. So it's impacting a lot of different areas for us. So the way that we have responded, I know a lot of people on this call know how food banks work, but in the event that there are any folks on the call who are new to food banking, traditionally food and money comes in our doors through donations. We partner with the state, we partner with the federal government to get really fresh, nutritious food in our doors. And then once those donations arrive at the food bank, we have about 21,000 volunteers a year who repackage that food, they sort through it, and then it goes to our network of about 1,000 partner programs and agencies across our 6 counties. And then that food is directly provided to people who are food insecure across our area. So I would say really what one of the first disruptions was, we saw volunteers, especially volunteer groups, needing to cancel. And since we rely so heavily on volunteers, that really changed the way that we do things. And we were incredibly grateful when Governor DeWine sent us National Guard and Ohio Military Reserve members. So up in Cleveland, we have about 70 National Guard and Military Reserve members who are helping us get food out the door. If I made a list of all the ways they're helping, it would be probably like 100 bullet points long. So for the interest of time, I won't go into all of those, but they've just been incredible partners to us. And then the second disruption that we saw was really through our network of partners. So not to go into detail on this again, but we just saw the number of our agencies who had to close their doors going up and up and up. And we knew that we had to find a different way to get food out the door. So typically at the food bank up in Cleveland, we provide a monthly food distribution, mostly of fresh produce. And at that produce distribution, we have folks come in our building, they wait in line, and they're able to go into what we call our resource room and get connected to different community organizations and learn about what services are available. And we usually serve about 800 to 900 families per month through that one distribution. So it's a really busy distribution if you've ever been there to volunteer or seen it. But when this all started, our distribution was scheduled for March 19th, and we knew that we could not have 800 to 900 people in our building and still hit all of those CDC guidelines. So we decided that we would try drive-through distribution for the first time. And that was the beginning of our weekly distribution. So at that distribution, you can see I have a graphic on the right of this slide showing what our number of households served has looked like. I gave numbers for January and February just to show you what our typical numbers are. You'll see that it's in the 800 to 1,000 families per month typically in January and February. And then in March, when this all started, it went up to more than 1,200. And then by the next Tuesday, we decided to do another distribution, a drive-through. And at that one, we had more than 1,500. And then it started increasing in increments of 1,000 households per week. I've never seen this level of need. I don't think anyone probably on this call has ever seen this level of need. It was really eye-opening, and it showed how many people were losing their job or impacted by lost hours at work or a cut in salary or school closure. And at our distribution last week, we provided food to more than 3,500 households. The way that we do it is actually a drive-through where folks drive up. They can pre-register in advance. They get a number when they come in. That pre-registration number is used to figure out which family it is. And then they will go through the line, open their trunk, and a box of food is placed right in their trunk. So it's a completely no-touch, completely safe way to get food out to those we serve. And after the second distribution that we did in March, we actually had to move that distribution off-site because the need was so much greater than we could have imagined. We actually had a line of cars going back for more than 3 miles, and the city of Cleveland, the police department, had to cut the line off because it was an issue of public safety. So we've been partnering with our great friends at the city of Cleveland and using their municipal lot to host our distribution. And the one thing that really has stood out to me is that a third of the families that we've been serving have never been to a food program before. So this is a lot of folks who have been directly impacted by COVID, whether it's through those closures or the fact, like Lisa mentioned, that so many people are living paycheck to paycheck, and one lost paycheck just leads to a disruption in their budget. I included a few photos for those from the Cleveland area who have not seen downtown Cleveland in a while because you're sheltering at home. It's a little nostalgic, but that is the line of cars, the line of more than 3,000 cars that waited to get food. Our friends at the National Guard were helping us get that food out. And then I don't think I have time, but there was a really great story about a tow truck who picked someone up and brought them to our distribution. So if I have time, I'll circle back to that. And then really quickly, just a few of the other things that we've been doing. We've been providing about 9,000 backpacks per week to kids accessing to-go. Of those backpacks at CMSD, so the Cleveland schools, sorry, for those of you who aren't from Cleveland, the Cleveland schools, Parma, Garfield Heights, Breakthrough schools, and that has been a challenge. So the one challenging piece of that, just due to the way that federal reimbursements work on children's programs, those meals, those backpacks have been completely privately funded. So that is a something that's on the advocacy agenda going forward for us. We're also partnering with our friends at the National Guard, and we are delivering boxes of food to folks who are facing significant challenges getting food during this crisis. So people who are homebound or disabled and can't get out. It's difficult to meet the full demand. So that program, you can imagine the list is long for folks who are signing up. And then we're also providing walk-up hours at the food bank at least twice a week for people who are seeking assistance. And we're seeing about 150 to 200 families each week that way. I will not get into our policy priorities because Lisa really hit on all of them, and Rachel will talk through some of the SNAP priorities going forward. All I'll say is that SNAP is such a critical resource during normal times, but especially during any economic downturn right now. For every one meal that a food bank provides, SNAP provides 9. So it's just not possible for us to get through this without a strong SNAP program. One way that you can help us is to sign up for our advocacy updates. You can join our advocacy network at greaterclevelandfoodbank.org/advocate. We have an advocacy action right now where you can reach out to your member of Congress and ask them to increase SNAP benefits by 15% in the next COVID relief bill, and also increase the minimum benefit and suspend all of the administrative rule changes to SNAP that were in the works last year. Also, please spread the word. If you or anyone you know needs help and you live in the Northeast Ohio area, please call our help center. We can get you connected to food that you need and help you apply for SNAP. And then finally, if you're able, consider making a donation to your local food bank. Every dollar really makes a difference to us. And it allows us to be flexible. Right now, funds really are a way for us to be flexible since things are just changing so quickly. So I included the link on there as well if you're interested in donating or doing a virtual food drive. So on that note, I will pass it along.
Scott, you can take it away whenever you'd like.
Oh, okay. Can everybody hear me?
Yep.
Hi, good afternoon.
We sure can.
Great. This is Scott Neely, Government Affairs Director of Children's Hunger Alliance. Just want to thank, first of all, Danny, Kelsey, Tara for having us today. And thank you to the presentations from Lisa and Kimberly as well. That was some very good information. We're just pleased to be a part of this today. And I think as Lisa and Kimberly indicated, we're in unprecedented times right now in terms of food insecurity. I'll just give you some real quick background on Children's Hunger Alliance. We were founded in 1970. We're an organization committed to ending childhood hunger in Ohio. And we are headquartered in Columbus. We have about 45 staff members serving Ohio's 88 counties. We have 3 regional offices in Cincinnati, Cleveland, and Toledo. I think I saw Kelly Malcolm's on the phone call from our Cleveland office. So we have some staff that are on this call today. Before this COVID crisis hit, our work has been focused on, a lot of our work is through the USDA sponsorship of the Child and Adult Care Food Program. We have over 300 after-school sites that we sponsor. We have 750 family child care providers, 30-plus daycare centers. Actually, during this crisis, about half of those family child care providers and daycare centers have converted over to pandemic facilities, which means they can service first responders, families of first responders. So about half of those are still operating. Most of the after-school programs have closed, but several sites are converted to emergency sites, which we'll talk about here in a minute. We also do summer meal sites through the USDA Summer Food Service Program. We work with schools to increase breakfast participation. Ohio right now is only 26 in the country in breakfast participation, 56% of school lunch participation, so we can do a lot better there. And we also work to educate and engage children, families in nutrition and physical education. So that was our normal work up until the COVID crisis hit. And so what we've focused on since then, we happen to, I think Lisa and Kimberly did a real good job about talking about the supply chain crisis. We had plenty of food to start when this crisis hit. We've been doing a lot of shelf-stable meals, so we were well prepared. When it hit, we had 18,000 meals that we were going to pass out through 5 different schools in Ohio for the spring break. We were going to pass out meals at some of these urban schools. Well, when the crisis hit, we turned and we got a request from the community action agencies, and we passed out 18,000 meals through 27 community action agencies. So we were ready to go to help them right away. But we'll talk about how some of that dried up pretty quickly. We also were approved to be a summer sponsor by ODE. So that allows us to do emergency feeding in non-congregate settings, grab and go meals, which is very, very important to get that approval. And then we also are now serving meals to approximately 100 emergency sites across the state, including Cleveland and Cincinnati rec centers. If you go to our website, children'shungeralliance.org, you can see a map of all the emergency food sites that we're doing across the state. So that's a really helpful resource if you get a chance to take a look at that. And let's see. Did I skip over? Okay, and so we're also doing, in Columbus, we're doing 3 library sites. Even though the libraries are closed, we're doing drive-through sites in Columbus and at St. Stephen's Community Center. That's been a really successful program. And we're actually, I'll talk about here in a minute, the Panera Bread partnership. They're doing Panera Bread meals through those 4 sites. We're serving over 750 kids each day at those 4 sites. So that's been tremendous. We're also going to be doing dinner at all Columbus City School meal locations. We're going to phase that in over the next couple of weeks. And that'll be providing 15,000 meals weekly. We'll also serve 70 homebound meals as a part of that collaboration. And I mentioned Panera Bread, and that kind of came out of the blue, that partnership. And if you go to our website, you can see the press release and actually a video of the CEO of Panera announcing the partnership at the White House. So pretty amazing partnership. It's just a pilot program right now at those 4 sites in Columbus. They're doing the children's meals, and we're also doing, a fruit with that meal. And we have plans to expand that further, hopefully in Columbus and additional Toledo sites. So that's a pretty neat partnership there. And we're continuing to look at requests to provide food. What our goal is just to fill in gaps. We're not trying to compete with the schools. We're not trying to duplicate any efforts there or the food bank or anybody else. We're just looking at areas that have a need for food, and so we're looking at providing meals to sites that don't have any meals at all in that particular area, or a third meal if it's not Columbus City Schools, which we already talked about. And then we're also, and I think Lisa and Kimberly hit on this very well, that we are really struggling in terms of the food supply chain, and we're having trouble getting enough meals. Our vendors no longer have the supplies of food that they had, and so we've actually bought the components, and we have our staff at our headquarters here making meals, putting together meals. We're going to do hopefully, well, we've got components for 240,000 meals. We'll see if we can do all of them, or we may have our vendor do some of those. But we have people coming in, volunteers. We've had, elected officials. Senator Coonsey brought her staff today. I mean, anybody that wants to help, and I'll put the link up here in a minute, we really can use help on this. So we're also talking in a kind of unique partnership with the Columbus City Police, Franklin County Sheriff, and Ohio Association of Police Chiefs. When they go out on their calls, they encounter families with children that are hungry and needy, and we want to have them to be able to have shelf-stable meals, whether it's in the fire truck, the police car, or whatever, that they can pass out to children that need these meals. And so we're talking to these organizations about supplying them with meals that they can pass out to children that are hungry. So that's just kind of a quick snapshot of some of the things that we're doing and how you can help. As I mentioned, we have a link here for signing up to put together meals here in our Columbus office. Also, if you know about areas that need our help, please let us know. And we're getting a lot of people contributing too. We've had Joe Thomas and Andrew Hawkins, former Browns players. I think they have like a radio show. They've been out there trying to raise money for us. The Cavs have helped. Bernie Bickerstaff, the coach of the Cavs. A lot of people are helping out. So we just really appreciate everyone's support. And that's pretty much it for mine.
Thanks, Scott. This is Rachel Cahill, and I will wrap us up here by zooming out a little bit and talking about policy and our recommendations and all we've sort of done so far and what we still need to get done to meet these big needs that we're seeing in our community. And I'll make sure everybody can hear me too. Can I get like a thumbs up or somebody? Yeah, okay. Great. So I am a consultant that works with the Center for Community Solutions. I live up in the greater Cleveland area, so I'm good friends with the Cleveland Food Bank and with all of the folks who work so hard on the ground here. So I've just really been in awe of their creativity and determination to rise to the challenge. So I'm proud to be on this webinar and on a lot of other calls and meetings with you guys. So I want to run through a few things that we've already accomplished. So, a lot of credit goes to the Ohio Department of Job and Family Services for doing a number of things right away that became available to make the SNAP program, and that's the food stamp program, more flexible and responsive and allow counties to process applications more quickly. So a couple of things we've already done. SNAP emergency allotments have gone out for all the households who were enrolled in March and were not already receiving the maximum benefit. We have postponed redetermination. So if you were up for renewal in March, April, or May, those are postponed for 6 months. So nobody should be losing their benefits because they were at their renewal point but didn't have the opportunity to renew. We've simplified applications dramatically. I was doing SNAP work in Philadelphia during the Great Recession, and we got some flexibilities then, but never to the scope that we're getting right now. County workers can approve applications without doing an interview if they have the necessary verification. There's a number of flexibilities that are pretty unprecedented that the federal government made available and that our state pursued and has gotten in place already. We've waived work requirements and time limits for the moment because, of course, people can't be and shouldn't be reporting to job sites where it's unsafe. There's some really good new flexibility in WIC and the child nutrition programs. Some of them were mentioned, like the non-congregate feeding permissions. In WIC, there's a waiver of the face-to-face requirement that is typically part of WIC. So there's important things there that I'm not going to go into in as much detail, but happy to follow up with folks that are interested. And again, Lisa mentioned their really Herculean effort to get the Disaster Distribution Authority to distribute meals more safely and more quickly at the food banks. So that's kind of what we've done so far. Of course, we have a lot we still need to do to rise to this challenge. And so we just have over the past week really elevated our sort of phase 2 asks around hunger. So this is an overview of our state recommendations and asks. I'm going to go through each one of these individually just to make a little bit of sense of them. But here it is on one slide in case you want one slide to walk away with and know what we're asking for. So the first number one priority is to implement the pandemic EBT program. That is a new program that was authorized by Congress in the Families First Act. So that was the second of the 3 bills that have been passed so far. This is a replacement for the school meals that families are missing out on every day. So I'm sure a lot of you know or have been part of meal distributions that have happened out of schools and are happening to try to meet that need. It's impressive what has been happening around the state, but it is only meeting a fraction of the need and a few of the students really in relative terms to who normally gets access to school meals. So Congress anticipated that this would be a big problem when they saw that schools were beginning to close in early March. So they put this new program in place that is an EBT card, like a SNAP card, but a separate program that would go to all families who normally get school meals. So a couple of states have already been approved. A lot of states have submitted plans to the federal government to begin these programs. Ohio has not yet submitted a plan. So we're urging the state to do that as quickly as possible, which is the Department of Job and Family Services and Department of Education need to work together on that plan. We know that they are working on it, they're aware of it, but we just want to see that plan get submitted as soon as possible so that we're not last in line to get that plan off the ground. And there's some resources I'll share at the end for some writing we've done for Community Solutions on this. So the next, if you're going to take one high priority, that is the thing we need to do right now. The next couple of things that we also want to see the state doing is sharing some data on this rising demand. So we know that we know from the food banks that there's spiking need. And we know anecdotally from some counties that they're beginning to see really big increases in applications for SNAP. So one metro county said it was a 3 times application increase. Another county said it's 5-time increase. We don't have any statewide data yet that really tells this in a more measurable way. So that's something we really want to get to quickly. We also want to understand if we're not seeing an increase in applications, there might be barriers that we need to address, things that or people aren't finding their way to SNAP when they really need to be. So either way, we really want to understand. And I just gave this example of Louisiana. They put out this helpful chart recently on their application volume, and what is, don't worry about the little words except to see the spike in that black. That's the backlog. So as applications come in, each day, each week, they get a little bit higher and higher. A backlog is building in Louisiana. We don't want that to happen in Ohio. Hopefully it won't happen and isn't happening in Ohio, but until we see some data, we can't really say. So that's a key priority for us right now. And then next, I'm like slow at these slides. Let's see. Oh, I skipped. See if we'll get it to show up here. There we go. So I mentioned the emergency allotments that already went out for March. Another round is expected to go out at the end of April for those who have enrolled in April and again are not already at the maximum benefit. This is a little bit confusing. About 40% of households already receive the maximum benefit for their household size, so those families will not see an increase. There's an example here that I included, and we've included this on some materials on the Community Solutions website, but want to just make sure that families understand if they should be able, if they're anticipating that they'll be able to get a boost in their SNAP benefits. So the minimum benefit right now for an individual is $16 a month. That individual would see a really big boost, right? It would bring them all the way up to the maximum benefit of $194. That especially is helping seniors, individuals with disabilities who typically see lower benefit amounts. The flip side of this is, unfortunately, because of the way USDA interpreted Congress's authority, the families who are the very neediest and who already receive those maximum benefits and who we know need additional food support right now didn't see an increase. So that is on the list of things that we are pushing for at the federal level, which I'll get to in just 1 minute. We are asking for some administrative waivers from the state. I won't go into these, but things that would make it easier for the counties to process applications and also to deal with the interplay between unemployment that people will soon be getting, we hope, from the authority from the CARES Act that Lisa mentioned. Right now, folks are not getting those additional dollars. Once they do, it will kick some people out of SNAP eligibility. So their net, they will be better off, but not as much as if we maintained their SNAP benefits. So we're trying to think creatively about ways to manage that so that that short-term boost in income that comes from that pandemic unemployment will not have people bouncing in and out of SNAP. And then lastly, this came up in the chat, so I just want to address it. We are encouraging the state to pursue the SNAP online purchase pilot. About 10 states are already approved to do online shopping with home delivery through SNAP. There are a lot of complexities to this, security issues that have delayed the program for a number of years in a really unfortunate way, and it's really showed its consequences in this pandemic that we don't have this more widely available. It's worth noting that more than half of the SNAP households in Ohio do include an elderly or disabled individual who we know are at high risk right now and don't want to be going to the grocery store. So we know that this is a high demand and a high need for this, and we are encouraging the state to move as quickly as they can to pursue this, but realistically, this isn't going to be something that we're going to get off the ground in the near term. So we do want to also be encouraging retailers to work with the state to figure out how to participate in what the governor called a click and collect program, which is really curbside pickup for SNAP shoppers. Only a couple of retailers across the state that we know of are able to do this right now, but anyone can, any of the retailers can if they have the right equipment, or the right logistics process. So we're encouraging more retailers to participate, but of course, we know there's a huge amount of demand on them right now, and they have a number of things they're trying to figure out. But that's something I think we can all work on together in the short term. And then the last recommendation is really to think about raising our SNAP gross income limit. Right now, we are at the lowest income limit of states that states can put on the SNAP program, which is 130% of poverty. We can go all the way up to 200% of poverty. This is a state option that we could take at any time. Remember, SNAP is 100% federally funded, and those are dollars our communities need now and will continue to need as a recession continues with state and local revenues declining. The other way to think about this is essential workers who are working right now in our grocery stores, in other places for relatively low wages, really fall into this gap, this 130 to 200% of poverty gap, and would really benefit from a boost in purchasing power that would come through SNAP. So this is something that has been talked about and has been done in other states, and actually was taken up in the last recession by a number of states across the country. And we think now is the time for Ohio to consider it as well. So I'm going to spend my last minute here on the federal recommendations. So in addition to all the things the state can do, we need a SNAP benefits increase across the board. As I said, a lot of families haven't benefited from the temporary boost in the maximum allotment. We need to see that 15% bump, and we need it to last until the economy recovers. In the last recession, there was a boost, but it was arbitrarily cut short, and real pain was felt when those benefits were cut. We really need to keep this in place until the economy is where it needs to be and people don't need the extra support anymore. We also need to see the SNAP minimum benefit increase. That is, again, a long-standing problem that any agency serving aging and disabled populations will tell you is a barrier to SNAP participation amongst those populations. So we really want to see that. Kimmy mentioned the proposed rules that would have limited eligibility and cut benefits that need to be suspended. And then with that pandemic EBT program I mentioned at the beginning, we really want to see that continue at least through the summer, if not through the beginning of next school year, to make sure that families have a more efficient way to access those missed school meals, instead of having to go to a pickup site, every day and pick up a meal the way that in some places they're able to do now. So I will stop there. I know some questions have come in. Danny, I'll let you run through what you'd like us to answer.
Great. Thank you so much, Rachel, and thank you to all of our presenters. With our last couple of minutes, first thing, the slides will be available immediately after the webinar, and I'm going to pose these questions, and any one of our presenters who wants to answer, please feel free. So the first one is, what sort of organizations are on the philanthropy task force? Anecdotal evidence of healthcare institutions being overwhelmed by non-cash donations is what the person says.
I can't speak to the non-cash donations that may be going into the healthcare system. The philanthropy strike force that's been convened really is staffed large part by all of the state agencies. The co-chairs are Director Lori Chris as well as Director Hall. I think the intent was to gauge whether philanthropy could step in and fill some of the gaps, and certainly what we're seeing is in the short term, there may be some opportunities of one-time grants or low-cost or no-cost loans to help bridge funding until some of the federal funding comes in. Some of the other groups that are on include the Coalition on Housing and Homelessness in Ohio, the Ohio Association of Community Action Agencies, a nationwide foundation, Claudia from Philanthropy Ohio, as well as the Catholic Conference, Boys and Girls Clubs, the Wise, and Goodwill. I do want to say that one of the impacts of such a sudden collapse of our economies has been the really catastrophic impact on our nonprofit organizations. We are seeing some of the largest nonprofit organizations in the state of Ohio have gone to furloughing the majority of their staff. So many of the services that are provided are based on a fee-for-service, and those fee-for-service programs have ceased, therefore revenue has ceased. So we really need to think strategically, not just about the role of philanthropy, but the role of government, and how do we stand these organizations up? They're going to be critical to providing basic services to more and more vulnerable families than ever before.
Great, thank you, Lisa. The next question someone asked is, are the City of Cleveland rec centers effectively distributing after-school meals?
I could probably answer that question. Yes, they are distributing meals at all the rec centers, and the hours, I believe, are posted on our website. But I can get those if people want to know the hours. But I think most of them, I'm not sure. There's a few that may not be, but I believe the majority are distributing meals at the rec centers.
Great. The next question we have, does anyone know the status? Oh, excuse me, my computer just jumped a bit. Sorry. Does anyone know the status of SNAP EBT acceptance and ability to redeem produce perks at online retailers as well as grocery delivery services like Instacart?
Yeah, this is Rachel, and I think there's a couple questions related to this that I saw. So I'll just say real quickly. So as I said, the online purchase pilot is something that our state will need to get into. So you can't use SNAP right now for any online retailers that involve grocery delivery. So that includes Instacart. There are some conversations about it. In some states, there are just Amazon and Walmart who are doing that. In some of the approved states, there are also some local retailers who are part of some of the early pilots. But again, those pilots took time to get set up, and for those more local retailers to get their systems up to the security standards. So that is a trade-off to think about. Is doing a program in Ohio quickly probably means limiting the number of retailers that participate, as opposed to taking the time to set up a program that has more retailer involvement. So I think the more we're engaged with our grocery retailers to come up with solutions that can quickly get social distancing, safe shopping for EBT users is the best way to move forward.
Great. So next question. Hearing that Ohio public schools are looking to reopen around May 8th, will that impact the EBT effort you discussed?
Yeah, this is Rachel again. I'll answer that. So the pandemic EBT program will be retroactive to the date that schools close. So even should schools reopen, there are all those days that school days were missed would be able to go to families on an EBT card. A lot of other states have planned for the end of the year closing, and so we're just going to do a single issuance to households for all of the days missed. But Ohio could say, if we were closed for 42 days or whatever it ends up being. We know families are still going to need those dollars for food. So we still want to see the program put into place regardless of when and how schools might reopen.
Great. And we want to be respectful of people's time, so I think this will be the last question. Cuyahoga County was already struggling to meet demand for SNAP with their changeover to a phone banking service model. How are they doing now?
Yeah, I'm sure Kimmy could speak to this as well. Actually, I will say we are really happy to see how Cuyahoga County and a lot of the counties have responded. They, just like everybody else, closed their doors and had to figure out work from home. They did that pretty quickly, and we already have that call center functionality that was a very rocky transition, has been a rocky transition, has actually been somewhat of a godsend in this moment because they could continue delivering service that way. We're actually, Cuyahoga County, the last I heard, is actually answering more calls, a higher percentage of calls, and has more stable wait times right now than they did, in the height of the transition and even a couple of months ago. So I'm hopeful that our counties, all of them, can continue to rise to the challenge. But we don't know. Again, once we see this data come in about how many applications they're seeing, what they're managing well right now might not might not last. But for now, those lines are open. People are struggling with unemployment, but SNAP is there. People should be applying for it. And we need to be encouraging people to do that and letting them know that it's not as difficult and as scary to do, maybe as it has been in the past.
This is Tara with Community Solutions. I just want to thank everyone for joining us today. I think there's a couple of questions we weren't able to get to, and we will be happy to share those with our presenters via email afterward and make sure that we're able to get responses to the remaining questions. Thank you for all of the time that you all have given us this afternoon. Thank you to our presenters. We will be posting this on our website and wherever you got the email to sign up for this, you'll be able to easily find it on our website or via Advocates for Ohio's Future. Thank you all again for joining us and have a great weekend.
Thank you.